I think one of the most important questions we're going to have to ask and answer is, how do we reinvent capitalism after this disaster? Check it out, leave your comments, ding the bell, share it with your friends, and subscribe to our channel. And on this rant about, what is happening with basically unregulated capitalism. We used to have, for example, used to be in most states, I know it was in Michigan when I was growing up there, and when the first two businesses that I owned were in Michigan, that you had, if you ran a hospital, it had to be a non-for-profit company, a nonprofit company. If you ran a health insurance company, it had to be nonprofit. Now, it might have been legal in some states for them to be for-profit. I don't recall, frankly, but it used to be nonprofit, and you used to have actual employees that you paid. Well, it turns out that the hospitals are contracting with companies that provide HR services, right? So the hospital, say there's 1,000 people working in the hospital. What the hospital does is those 1,000 people actually don't work for the hospital. They work for a separate company. For example, Algae. And yes, that's one of these companies. It's called Algae On Health. And Algae then pays the employees, and they negotiate. Well, they don't actually negotiate with the employees because nobody has unions in these areas. But basically, they say, okay, you're going to get a 401k, and here's what your pay is going to be, and blah, 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 blah. And then they go to the hospital every month and say, okay, your payroll this month was, $47,000 or 140, whatever it is, And so the company writes one check to the payroll company. And then the payroll company deals with the employees, because those employees don't actually work for the hospital. They work for Algae. And Algae is actually owned, I believe Algae is owned, by one of these private equity companies. Yeah, well, actually, I don't know about Algae. Team Health is bought by Blackstone Group in 2016. That's a company that basically employs doctors, nurses, et cetera. And Envision Healthcare is owned by KKR. So, which means that they're going to just be brutal. And here we go. This Isaac Arnsdorf over on ProPublica. This was a ProPublica investigation. Most ER providers in the U.S. work for staffing companies that have contracts with hospitals. Those staffing companies are losing revenue as hospitals postpone elective procedures. Health insurance companies are also processing claims more slowly. So Steve Holtzclaw, the CEO of Algae On Health, put out a memo saying that the company is going to be reducing hours for clinicians, cutting pay for administrative employees by 20%, suspending 401k matches, suspending bonuses, and suspending paid time off. In a follow-up memo sent to salaried physicians on last night, Algae said it would convert them to an hourly rate, implying that they would start earning less money since the company already had said it was going to reduce their hours. One doc who works for Algae in a hospital says it's completely demoralizing. At this time of all times, we're putting ourselves at risk, but we're also putting our families at risk. And there are extra burdens on these people, on the employees. I mean, a lot of these docs and nurses and hospital workers are literally having to live separate from their families, and that can be very expensive. Not to mention, very troubling. Other employers will probably follow suit, Holtzclaw said. He's the CEO of this one company, citing conversations with his counterparts across the industry. He wrote, quote, "You can be assured that similar measures are being contemplated within these organizations and will likely be implemented in the coming weeks." Algae is owned by a private equity company called Fraser Healthcare Partners. This is mind-boggling. Hospital operators that actually employ their doctors have also announced cuts. Tenet Healthcare said it's going to postpone 401k matches. It's going to tighten spending. Emergency room doctors at Boston's Beth Israel Deaconess Medical Center have been told some of their accrued pay is being held back. 1,100 staffers at Atrius Health in Massachusetts are facing reduced paychecks or unpaid furloughs. Raises for medical staff at South Shore Health, another health system in Massachusetts, are being delayed. And this all despite the fact that in that $2 trillion package, there's hundreds of billions of dollars earmarked specifically for hospitals. They will take that money on the back end and fatten their bottom lines, but they're screwing their doctors right now. Meanwhile, in Kansas, the Sumner County Hospital shut its door unexpectedly after the close of business last Thursday. Why? Well, they said that the state of Kansas did not expand Medicaid, and therefore they're operating at a loss, and that loss is getting more severe as COVID patients are showing up without insurance. So they just shut the hospital down. This is the 6th rural hospital in Kansas to close. Wait until this thing hits the red states. Donald Trump thinks that, everything's going to be fine because this is just taking out the big cities and the blue states. It's taking out Seattle. It's taking out New York. It's taking out Detroit. It's hitting Chicago. Oh boy, oh boy, oh boy, says Donald Trump. Well, you wait until it starts hitting rural Kansas. You're going to have some seriously pissed off people out there. The main entrance to the hospital, they know, was blocked off with a blue plastic tarp. I mean, this is as bad as it gets. And then now is the time when the Obamacare, the special enrollment period is really needed, right? There's people who have no health insurance. They just lost their jobs. They no longer have health insurance. They want to get on Obamacare. So people right across the spectrum have been pleading with Trump to open the window, open the website so that people can sign up for Obamacare. Trump says, no, we're not going to do that. We're not going to do that.